Some patients lose up to 20% of their bone mass in the first 6 months of taking this medication, not from the disease it was prescribed to treat, from the pill itself. The
Please
FDA
note that
label
this
lists
medication may cause
osteoporosis and
serious side
fractures as
effects,
known
including
consequences of long-term use.
osteoporosis and fractures.
Most people prescribed it for
So,
inflammation
wait,
have no idea the drug quieting their immune
osteoporosis,
system
no,
is doing
niente
something else
perché la
entirely to
gente
their
durante
skeleton. There is a medication that can feel like a miracle for someone in the middle of a severe lupus flare, for someone whose rheumatoid arthritis has made it impossible to walk, for someone whose immune system has turned against their own
Thank
body.
you, doctor. I appreciate
Prednisone
it.
can turn the crisis around in days. The inflammation retreats, the pain eases, the body finds relief it may not have felt in weeks. That relief is real, and for many people, it is genuinely life-saving. But the FDA label for prednisone contains a list of consequences that most patients are handed without explanation. And among those consequences, one that builds invisibly over months and years until the day a routine fall produces a fracture that should not have happened. That consequence is bone loss. And it begins from the very first dose. Prednisone belongs to a class of medications called corticosteroids. The body produces its own version of this class of hormone, cortisol, in the adrenal glands. Cortisol controls inflammation. It regulates the immune system. It helps the body respond to stress. When inflammation becomes dangerous, when the immune system is attacking the body itself, synthetic cortisol in the form of prednisone dramatically amplifies that regulation. It suppresses the immune response. It reduces the inflammatory signals. It quiets the reaction that is causing the damage. For the conditions prednisone is prescribed to treat, rheumatoid arthritis, lupus, asthma, inflammatory bowel disease, severe allergic reactions, this suppression is often exactly what is needed. But the body's own cortisol does more than manage inflammation. It regulates how the body builds and maintains bone. And when synthetic cortisol arrives in large amounts, it disrupts that regulation in ways that directly accelerate bone loss. Here is what happens. Bone is not static. It is living tissue in a constant state of remodeling. Two types of cells manage that process. Osteoblasts build new bone tissue. Osteoclasts break down old bone tissue. In a healthy body, these two populations are roughly in balance. Old bone is removed. New bone replaces it. The structure remains strong. Prednisone shifts that balance. It reduces the activity of osteoblasts, the cells that build new bone. It increases the activity of osteoclasts, the cells that break it down. It reduces the absorption of calcium in the intestines, meaning less of the raw material for bone construction reaches the bones. It increases the amount of calcium excreted through the kidneys, meaning the body loses calcium faster than it otherwise would. All of these effects work in the same direction. Less calcium absorbed, more calcium lost, less new bone built, more old bone removed. The result, bone density declining faster than it should. The FDA label states this directly. Osteoporosis and vertebral compression fractures are listed as known consequences of long-term corticosteroid use. The label specifically warns physicians to monitor bone density and consider protective treatment in patients who will be on corticosteroids for extended periods. Research has confirmed the scale of this effect. Some patients lose between 3 and 5% of bone mineral density within the first year of use. In patients on higher doses or longer courses, the losses can be steeper, and some studies have found that patients on long-term prednisone can lose up to 10 to 20% of bone mass in the first 6 months of treatment. That is not a gradual process. That is a significant structural change happening inside the body, while the person taking the medication is focused entirely on managing the condition that brought them to prednisone in the first place. The bone loss itself produces no obvious warning sign, no pain, no sensation. The bones become less dense, and the person continues going about their daily life with no indication of what is changing inside. Until a fall that a healthier skeleton would have handled without consequence produces instead a compression fracture of the spine, a broken wrist, or a fractured hip. How long have you been taking prednisone? A few weeks? A few months? Let us know below. What comes next is something most long-term users are never told. Beyond bones, The FDA label identifies several other consequences of long-term prednisone use that most patients are never walked through when the prescription is first written. Blood sugar. Prednisone raises blood glucose levels, often significantly. In patients who are not diabetic, this elevation can be dramatic enough to temporarily produce blood sugar readings in the diabetic range. In patients who already have diabetes, prednisone can make the condition dramatically harder to control. This is not a rare side effect. The FDA label documents it directly under endocrine and metabolic effects. And yet, many patients taking prednisone for inflammatory conditions are not monitoring their blood sugar. Their prescribing physician and their diabetes doctor, if they have one, may not be coordinating their care. The adrenal glands. This one is perhaps the least discussed and among the most important. When prednisone is taken for an extended period, the adrenal glands, which normally produce cortisol, begin to slow their own production. The brain detects that cortisol is present, supplied by the medication, and reduces the signal telling the adrenal glands to make more. Over weeks and months, the adrenal glands may reduce their own output significantly. If the medication is then stopped suddenly, the adrenal glands cannot immediately compensate. The body finds itself without the cortisol it depends on for basic function. The result, a potentially life-threatening condition called adrenal crisis. Severe weakness, dangerously low blood pressure, and collapse. The FDA label warns directly and emphatically that prednisone must never be stopped suddenly after extended use. The dose must be reduced gradually, tapered, over time. This is not a recommendation, it is a medical necessity, and yet, many patients taking prednisone for months or years have never been told why they cannot simply stop. None of this means prednisone is the wrong choice. For severe inflammatory conditions, for autoimmune disease, for acute asthma, for conditions that would otherwise cause permanent organ damage, prednisone remains one of the most important tools in medicine. What it means is that the consequences of taking it deserve the same level of attention as the condition it was prescribed to treat. For bone protection, research consistently supports calcium citrate and vitamin D supplementation for patients on long-term corticosteroids. Many doctors now routinely prescribe bisphosphonates, a class of bone-protecting medications, alongside long-term prednisone to slow the accelerated bone loss. A bone density scan before starting and periodically during long-term treatment is widely recommended and widely overlooked in practice. For blood sugar, checking glucose regularly during prednisone treatment is commonly recommended, particularly in patients already at risk for diabetes. Dietary adjustments, reducing refined carbohydrates, are also discussed as supportive measures. For the adrenal system, the single most important instruction is never stop suddenly. Any reduction in dose should happen slowly and under medical guidance. And the questions worth bringing to the next appointment: has my bone density been measured since I started this medication? Is anyone monitoring my blood sugar while I am on prednisone? What is the tapering plan if and when this medication needs to be reduced or stopped? Is the dose I am on the lowest effective dose for my condition? These are the questions of someone who understands that a powerful medication requires active monitoring, not just a refill. If this video helped you understand prednisone differently, subscribe to Med Truths. Every week we read the label so you know what to ask. Here is the truth about prednisone. It suppresses the inflammation that is damaging the body. That suppression can be life-saving, but suppressing inflammation requires suppressing the same hormonal system that builds and maintains bone. And every day of suppression, at sufficient dose and duration, is a day the body is losing structural material it cannot easily replace. The bone loss is in the label. The adrenal warning is in the label. The blood sugar risk is in the label. It has always been there. You just needed someone to read it out loud.